Dr. Dan Hatef joining us tonight for Medical Monday. Thank you for joining us as well. I promised we would get right to the lines. We're talking about plastic surgery, in particular facial plastic surgery, and also non-invasive procedures. So let's get to Carol. She's got a question for the doctor. Hi, Carol.
Hi, good evening. Thanks for taking my call.
You're welcome. Go ahead.
I was wondering if the doctor had any experience using Volbella as a tear trough filler, and if so, what was his thoughts on that, or are there other products that he prefers? Should I hang up to listen to the answer?
You can hang up, and I'll just put you on hold, and you just turn up your TV now. Thanks for calling, Carol.
Thank you.
All right. Okay.
Carol, thanks for your call. Yeah, I've used Volbella. I think that Voluma is the best thing for the tear trough, actually. And it got a bad reputation when it first came out, Voluma. So there's a family of fillers from Allergan, Voluma, Volure, and Volbella. And I love all three of them. But I've really started to use Volure and Voluma exclusively, just because they both work so well in their own way. The reason Voluma got a bad reputation is people were putting too much in the superficial aspects of the cheek, especially medially. And I've had people come to me complain that they feel like they look like a rabbit, or they're too full next to their nose. And so, Carol, the thing to do is, I like Voluma, it's the best, but I can use any filler and really treat the tear trough. And the way you do that is you just fill a little bit in each fat compartment. And when I do that, I go essentially around the tear trough in a clockwise or counterclockwise manner, and that really helps volumize that area, so that the orbicularis retaining ligament that's causing that appearance, it's lifted up, and it's not under the weight of the entire dermis of the cheek, so that muscle can relax. It gives a softer appearance. I
see that there's a nickname for all of these things.
There are,
What
yes.
is the teardrop, or what are we talking about?
The tear trough is this line that comes across here. People call it the lid cheek junction.
Yeah.
Even in our literature, you can open up a plastic surgery journal, and it'll be called 3 different things by 3 different authors. Malar crease, malar groove. I mean, there are many different.
So it's just when this area is very pronounced, like you just have a big crease right here?
So when people age, you see they have 2 elements to it. One, medially, is just a straight line, and then as you get out towards the outside of the eye, it comes up like this, and then something comes across their cheek here. And what these are from is from the fascial retaining system of the face. It's actually throughout our whole body. We have dermis in our skin. We almost have a little sheet of dermis deep to that underneath the superficial fat, and so it sends up septi into the skin, and that's what I was working on in Dallas, really defining that facial skeleton and figuring out, where do these things insert? How can we either cut them and move them, or fill them? What's the best way to go about rejuvenating the face using that knowledge of facial anatomy?
All right, Carol, thank you very much for your call. We have Abigail on the line. Hi, Abigail.
Hi.
Hi, go ahead with your question.
Is there a difference between Botox and Dysport?
Abigail, that's a great question. I think I get that question about once a week. Dysport has become much more popular, and I use them both. They're basically the same thing. They're both botulinum toxin. They're just constituted a little bit differently. Dysport, you inject more units when you inject. It's about 2 to 3 per 1 unit of Botox. Basically the same price. The difference is Dysport's a little bit more painful. Dysport takes a little bit longer to kick in, and I feel like Dysport gives a little bit of a softer look. So when you come to me and you tell me your goals, if you say that you like people with their eyes really open, you like it when patients' brows peak, that tells me you want Botox. If you say you don't want to look like you've had anything done, you want to preserve the way you look, that's more of a Dysport patient. There's an age at which I won't use Dysport anymore, because in some patients you really want to get a brow lift with the botulinum toxin using. In those patients, I generally use Botox. It's just a little bit stronger, a little bit of a harsher look, which in a younger person isn't your goal.
You mentioned something earlier.
And Abigail sounds pretty young. So
she does.
Abigail, I'm guessing you're a Dysport patient, but come in and see me.
And you mentioned something when you first mentioned Botox, that you were talking about starting when you're youthful, and we had a woman call in who wondering about when she's pregnant, she used Botox.
Yeah.
Is it better to start early, or does it matter?
I think so. So I'm a big fan of starting Botox and Dysport when you're younger, and obviously I'm financially incentivized to do that.
Sure.
But really, the more that those muscles act on your skin and on the retaining ligaments that I was describing, the more it's going to damage those. So if you start when you're young, and just a splash, you don't want to paralyze if you paralyze those muscles for 20 years, guess what? They're not going to move. So you don't want to do that. But splash here and there when you're younger, every 4 to 6 months, and then increasing in frequency, increasing in dosage as you get older. I think it's the way to go.
Let's say when you hit 40 and up, and I can say that now that I'm 40, I can say that when you hit 40 and up and not feel bad about it, how much does that frequency have to increase?
Well, I'm 41, and I thought you were at least 5 years younger than me,
Thank
so
you.
that's good for you. So with getting into your 40s, the thing about getting into your 40s is your lids, your upper eyelids start to get heavier.
Yeah.
You're reading all the time, you're working all the time. At the end of the day, you're feeling tired. When your eyelids start to get heavy, you start to use this muscle to lift them up. And so the problem with Botox and Dysport when you're in your 40s is if you weaken this muscle too much, your brow's going to drop. So I talk to patients extensively beforehand about this. When they don't like those forehead lines and they're about 43, 44 or older, I tell them, look, we can get rid of those lines, but your brows are going to come down. And sometimes we'll try it, just, hey, you just got to know that that's how it's going to be for a couple months. And we can kind of touch it up by injecting even more around the eyes, around the root of the nose, so that these muscles are even weaker, so that the frontalis muscle, which is a forehead muscle that makes those lines, frontalis, whatever action it has left in it, can take over. So I actually see some patients that feel like they were botched because their brows are so low. It's not that they were botched, it's just that they wanted those lines gone. Their nurse injector took care of those lines, but now their eyebrows are too low and they feel like they don't look youthful. So paralyzing those or weakening those muscles around the eyes can help get that back up. You got to be careful though, because you can start chasing your tail.
And I'm going to ask you about that too. When people come in, whether they want Botox or they want fillers or something, more advanced, is it realistic for someone to want to look like they did 20 years ago?
With a facelift, it is. With a facelift, it's realistic to turn back the clock. Maybe not 20 years, maybe more like 15 years. 20 years is a pretty aggressive goal, and I don't know if we're there yet. One of the things that you've got to realize is when you look at someone who's aged, part of what you see as a youthful face is the eyes, and there's nothing yet that we can do to restore that bright light of the eyes. I was reading the Bible, and it said something about Moses died and the brightness in his eyes hadn't gone out. So maybe go to the foot of the mountain. And,
right. Maybe the answer is there.
That's the only way to keep that youthful eye spark.
Yeah, I mean, there are some things that just can't be turned back, is what it comes down to. Is like, and there is value in that. I mean, with age comes wisdom and hopefully experience, and that's okay too, right?
That's right.
We don't all have to look like we were 22.
Yeah, that's exactly right.
Do you ever tell a patient no?
A lot, yeah. Actually, I think one reason that I've gotten so busy so quickly is because I tell so many patients no. So they know I'm not here to make a lot of money. I'm an artist. I want to make you look great. So they know I'm going to tell them no if I don't think they need anything. I do a lot of rhinoplasty, and I turn a lot of potential rhinoplasties away, because if someone looks good and their nose wasn't done exactly right, but in general they're happy, they're breathing okay, and they look good, they're having a successful social life, I see no reason to try and make them look perfect. Some of my mentors that I really look up to, every single one of them had the same saying: perfect is the enemy of good. So I say no a lot.
Yeah. When you think about rhinoplasties, do people come in with pictures and say, I want so-and-so's nose? They do, really? Yeah. Is that good or bad?
It's actually great, because it lets me see what kind of dorsum they want. So the dorsum is this part of the nose, and your profile is very important. When you're looking at someone, typically you see them straight on or from what we call an oblique view. The profile is what people see in pictures, and so they really focus on that, and that's great because it's easy to get a nice dorsum. But when a patient comes in, I take a look at what do they like. Do they like a little bit more of a stylistic nose, almost like a ski slope with the tip projecting out a little bit, or do they like the straight dorsum? So that lets me know, what does this patient want? What kind of nose do they want? And what I've noticed is that the stylized nose is coming back into vogue. It was popular back in the day. It kind of went away, and I'm really seeing where the stylized nose with a little bit more of a tip projection is becoming popular. My buddy Ash Gavami, he's the busiest rhinoplasty surgeon in LA. He is a phenomenal surgeon, and he and I were talking about this the other day, and we both agree that it's coming back into vogue.
Why do you think that is?
I think that with so much access to social media and entertainment, people are seeing more and more noses like that. So a lot of patients in Los Angeles are getting that look, and I think that that's kind of the seat of entertainment, and so it's kind of spreading across the country.
Sure. If you're considering any kind of plastic surgery, any kind of skin care, filler, whatever, what should you be asking the doctor sitting across from you before you do anything?
So the most important thing is make sure they're board certified, and make sure they're board certified in plastic surgery. There are people who call themselves cosmetic surgeons, and they're not qualified to do what they're doing. So you want to make sure that you have a board certified plastic surgeon if you're considering plastic surgery. If you're looking for a dermatologist, make sure they're a board certified dermatologist. There's one area in surgery that I think that you can go to a non-plastic surgeon, and that's vaginal rejuvenation. There are some board certified OBGYNs who are dedicating their practice to that. I think that they do a phenomenal job, but you really got to research your doctor. Don't just do a Google search and see who comes up first. Ask your friends, go onto all the websites and really do your homework. The beauty industry is so advanced now that people can buy likes, they can buy good reviews on Real Self and Google. So word of mouth is still the best way to find out what's going on. Just get a feel for your doctor, see how much they've done, ask them before and afters, ask them how often they do something.
But I find it's hard when not a lot of people want to fess up to plastic surgery. So when you're trying to find out who's the best, who can I trust, not a lot of people want to name drop.
Yeah, and be honest with your plastic surgeon. I can't tell you how many people come to me and they say I haven't had plastic surgery, and come on.
I
mean, we know, we see it all the time. So, but be honest, because if your plastic surgeon is in a rush and they miss that you've had something, they might not realize that your septum doesn't have cartilage for a graft. They might not realize that, you have a scar there, that you've had surgery there, that flap has been undermined. So you really got to be honest with your doctor. Don't hide it from us.
Yeah, because it's only going to hurt you,
yeah,
right?
That's right.
In the long run.
Yeah.
Okay, very good. We have a really cool segment coming up. We're going to talk to one of your patients live and on the air, right? You want to set it up just a little bit?
Yeah, so this patient, she is an amazing patient, followed all my instructions, did everything right, and she got a great result because of that.
Yeah.
And she's just a beautiful person inside and out, and I'm excited that she's coming to talk to
all of us about her results. Well, that's a great tease. Okay, so now you know what's coming up after the break, and still we are taking your phone calls. If you have a question for the doctor, go ahead and give us a call. We'll get that lined up during the break. 615-737+ is the number to call.